Hello, this video is about HRT. So if you're somebody who is going through menopause or have been through it, and if you're wondering whether you really need to consider HRT or whether you missed out on it because you were not aware of it before or was willing to take it before. So this is a quick video about hormone replacement therapy, which we call as HRT. So just a quick word, which is probably going to summarize most of what I'm going to say, is the safety of taking hormone replacement therapy largely depends on the age when it is started. So the British Menopause Society and other International Menopause Society guidelines say that women younger than 60 years should not be concerned about the safety profile of HRT, although it's not universal, it applies to most women. For some women, obviously there are some contraindications why they can't take it, or some do not tolerate it, and that's probably after a clinical consultation. But for most women, the potential benefits of HRT, given for a particular reason or a clear reason, the benefits are more than the risks, and the benefits are even more the sooner they get started on HRT within few years of menopause rather than, for example, 10 years later. Just to quickly summarize the symptoms of menopause, which are going to be short limited and which are not going to be short limited in the sense they have long-term health consequences. So obviously the first thing that most women notice is the period changing. For some, the periods may have stopped because they're on some kind of contraception that stops their periods. So if the period changes, if they turn heavy and they're having hot flushes, brain fog, menopausal headaches, migraines, mood swings, all of those are time limited, which is good news. That means they don't last forever. For most women, they last around 4 to 7 years, for some a bit longer. But what doesn't get better or what gets worse if nothing is done about it is the heart health, the metabolic health, which means risk of developing diabetes, having fatty changes in the liver, having thinning of the bones and putting oneself at risk of osteoporosis. The other thing, which is again not spoken about a lot, is the changes that happen in the genitourinary system, which is down below, having vaginal dryness leading to incontinence, lots of urine infections, prolapse, etc. And as I said, vascular effects, including putting oneself at risk of heart attacks and strokes. What HRT works best for, definitely, and where there is science proven evidence, research proven evidence, is for hot flushes. So there is 50 to 70% relief. That means it's still not 100%, so women may still get some flushes, but much better. And also it helps a lot with genitourinary symptoms of menopause, which is vaginal dryness, because it brings the mucosa back to its pre-hormone, pre-menopause levels. So those are the two things for which there is strong evidence. There is mixed evidence, or the symptoms may improve only as much as 20 to 30% for some of the symptoms, which is brain fog, sleep, weight changes, anxiety symptoms. So for them, there is more evidence that lifestyle changes help them rather than relying on HRT alone. So in terms of HRT or hormone replacement therapy, there are mainly two hormones that are replaced. One is the estrogen and the other one is the progesterone. So everybody gets estrogen. So if somebody is on HRT, that's the hormone that's there in all kinds of preparations, estrogen. Some women need progesterone, some women do not need progesterone. Some women need progesterone continuously, someone need it cyclically, in the sense only a couple of weeks a month. So that depends on a lot of factors. One, whether they are going through the change. So if somebody is going through the change, they will need the progesterone given in a cyclical manner, so it imitates their natural cycles. If somebody had a hysterectomy for whatever reason, they do not need to bother with the progesterone, because the main aim of giving the second hormone, progesterone, is to protect the lining of the womb from the risk of endometrial cancer. So if somebody had a hysterectomy, they do not need the progesterone, obviously. And somebody has gone through the change, that means where they haven't had a period, natural period for 12 months, we call it menopause at that point, they can have both the hormones in a continuous form where they do not bleed at all. So it will be non-bleed form of HRT. So the benefits of HRT are multiple. Obviously, the main thing is it's going to give relief from symptoms, including hot flushes. It has beneficial effects on the mood as well as the brain fog. While a woman takes HRT, it protects them against thinning of the bones, that is osteoporosis. So if somebody had very high risk factors for osteoporosis, a maternal history of hip fracture, taking HRT if they have other symptoms is a very good idea. HRT is also known to have cardiovascular disease prevention factors. That means it helps, it lowers the risk of heart attacks and strokes. So these are the benefits, and just some pictures of how different forms of HRT look like. So estrogen is the one that is the main hormone that is going to give relief from all the symptoms we're talking about, and it can be taken in the form of a patch or a spray or a gel or a tablet. And the progesterone again can be given as a tablet or as a patch together with the estrogen, or the other kind that is licensed is the Mirena coil, which is a contraceptive coil, but it also has the license to be used as the hormone component of your hormone replacement therapy. The only difference is that it needs to be changed every 5 years if used as hormone component. If somebody is having heavy periods, especially around the menopause, perimenopause, the periods may get heavier and infrequent, having Mirena coil may be a very good solution. The other hormone called estrogen, which is in a tablet form, again it can be given cyclically, 2 weeks in a month or continuously. It's a natural or identical to the hormone that your body produces. So it has got less risks compared to other forms of progesterone in terms of breast cancer risks. So it's more breast friendly, and also it has got slight sedating properties, so it may help women with the sleep side of things as well. So that's a very good choice to make. And the patches are usually changed twice a day. Spray is once a day, and gel, estrogen gel, should be applied once a day as well. The common side effects with the hormones, initially with the estrogen, some women have some breast tenderness and bloating and nausea if it is taken in an oral form. Progestrogens, again, sometimes fluid retention, like some women do have fluid retention just before their period is due, so similar to that, it may cause it initially with breast tenderness, but it usually initial side effect, and most of the time the body manages and adopts, and they get better. Thank you.